and now to welcome our second case study of the day. So we're joined by Darren Black, who's the CEO of the OzHelp Foundation. Those of you who know the men's health sector will know that OzHelp's been around for many years doing tradie tune-ups and other things like that, taking health services into the workplace with a particular focus on male-dominated workplaces. We're just going to have Darren talk about the work that OzHelp are doing before we move into the final panel and look at the third part of the model. Darren, the floor's yours.
Hi, Glenn. Thank you for having us join today. I've just got a couple of slides I was going to bring up. Am I able to share them, bring them up on a screen? Let's try that.
Yeah, have a go. You should be able to do that. Yeah.
I've got a message saying here the host has disabled the attendee.
I thought I'll try again. Make you co-host. You should be able to do it now. Just click share screen at the bottom. Talk us through it, Darren.
Yeah, my prezzo is not coming up when I hit the share screen.
And so you usually have a couple of options. You can share your actual screen, or you can share direct to the PowerPoint. There you go. We're moving now. And we should go from black to there. Yeah, okay. There it is. And if you just want to enlarge that, you'll have it.
Can you see that, Prezzo?
Yeah, just want to enlarge. That's it. We're in. All good, Darren. Over to you.
Okay. Thanks so much. Thanks for having me. Gents, as Glenn introduced, so I'm CEO of OzHelp Foundation. We've been around for quite a while, and we were an organisation established very much centered around counteracting suicide in high-risk workplaces, particularly the construction industry, and ultimately founded to improve men's mental health in particular. Now, these days we work across several industries, but they're all typically blue-collar, male-dominated work environments such as mining, heavy vehicles, transport and logistics. We're now doing some work with farming and agricultural communities, as well as with emergency services. But I just wanted to give you a short prezzo here, which really talks to one specific case study of a program we've been running successfully for some time. And I think it goes to one of those key principles in your male-friendly health services model, Glenn, particularly principle 2 around meeting men where they are. And it brings in a few other factors, I think, around building social connections and male-friendly activities and so on. But I'll take you through it fairly quickly, and then we can go to questions. OzHelp, we've been around for some time. We started in the ACT. We now run programs nationally. We were born out of the tragic circumstances of suicide of young apprentices in the construction industry. We do health promotion, training, and provide support services, including counselling. And as I mentioned, we work across a number of high-risk industries. And by high risk, I mean typically high risk in terms of the suicide stats compared to the national averages. The Tradies Tune-Up. This is a really simple, terrific program where our people essentially go out to the work site. And it targets male blue-collar workers, particularly in the building and construction industry. Here's a quick insight. I mean, we know from the stats that building and construction workers are likely to have poorer than average health outcomes. They work long hours, and it can be very difficult for them to get to see a GP or a doctor. But often the culture and the environment they're attached to seeking help dissuades tradies from seeking health, whether it's to do with physical or mental health. And so we take the service to them. What's involved? Well, this is what it looks like. In essence, it's a health check. It's a health screen, and our people who deliver it, sometimes we've got nurses out there with our wellbeing support workers, and they're measuring cholesterol, blood pressure, waist measurement, but also looking at things around depression, diabetes risk, nutrition, alcohol consumption and smoking, and so on. So there's a physical health screening process element to this, but critically, it becomes a start point for a conversation about what is going on in the life of that individual worker. And it's often those conversations that lead to a range of issues being discussed, and then help being sought before it becomes a crisis. We also provide ongoing support for those who reach out and who seek it, and we connect those through a number of other health services. Male friendly, and I think this sort of brings back to some of those core principles. We take the program into the work environment. So we will deploy into construction sites, mine sites, remote cattle stations, wherever the need is, and deploy teams of our health teams in to conduct the health checks and to initiate conversations, usually with men, and it's not singularly men, but typically the environments we work in are about 80% or more are male workers. And I think it's being accessible and being available, not coming from within the work environment. So we're independent, which makes a difference. And we're not part of the management or the chain of command of that organisation. So we find they're often more prepared to talk to our people than they are to their own bosses, and often their own mates and co-workers, depending upon the culture of that particular work site. As I mentioned, we don't just work in construction. There's a number of other initiatives we've got at the moment, and one is around a project we're working on with the National Heavy Vehicle Regulator to design, develop, test and evaluate a proactive mental health intervention for truck drivers nationally, just as an example of the sort of work we're doing and the sort of places we're getting to, and guys, typically that we're trying to support. So look, that's a bit of the backstory to OzHelp and the nature of the work we do, and taking very much a male-friendly health service out to where the guys are who often need it the most.
Great, thanks, Darren. So we've got a couple of minutes. Has anyone got any thoughts or reflections they want to share, either about Darren's work in particular and OzHelp's work in particular, or if I ask you to, actually, I should just stop sharing the screen now. That's it. Or about workplace approaches to reaching men. So.
It's Andrew King here. So I just wanted to say, yeah, great work, Darren, and that is a real achievement getting into workplaces that they're so hard to break into. So you've done really well.
Thank you.
Thanks, Andrew, and good to get a sound check on your mic, because I know you're joining us later. Anyone else? Jed, I'm just going to ask, because you made a few comments in the comment box, and I've seen you here a couple of times. I haven't actually had the opportunity to hear you speak.
Yeah, thanks, Glenn. I think it's great, really great sessions. I've been attending in and out because I've been doing some of the work as well. But it's great to hear, and I'm a nurse by trade, so we're really looking at workforce development. And the main gap in nursing is, as we know, it's a very female-dominated profession. So it's really a big issue. And listening to the guys talking about older men in aged care or older men having these health and well-being issues, I mean, one of the ways that we can look at it is, to have a proportionate number of male nurses who could understand the male sector or the issues about men. So that's what we're working on and it's good to hear Darren's presentation around a male-dominated sector and how we can apply these strategies in a female-dominated sector amongst men in nursing, so something like that. So it's really great, very helpful.
Yeah, thanks, Jed. You're one of 3 male nurses who will be speaking today. So yeah, we had Michael Whitehead in the first session, and we've got Mal Fraser coming up in the final session. I saw he gave a thumbs up when he heard you talking about men in nursing. So couple more points.
Glenn, I might just
go ahead, Darren.
Jed's comment there. Great to hear from you, Jed. And yeah, look, we would like to be utilising the support and services of more male nurses. I mean, currently, I can tell you across our team profile, our nurses are all female. They're typically blonde, and the male construction workers and miners and truck drivers and so on, as you'd imagine, are typically very happy to talk to them, which we find is useful in establishing rapport and a conversation to begin with. But I think we could use more male nurses out there working in those sort of frontline environments.
Yeah.
Thank you.
It's perfect. Thanks, Darren.
Right, and we'll be hearing from a male nurse who used to be blonde, but we're not entirely sure what. Spot which person on the screen I'm talking about, if you can. We'll see in a minute, Mal. You'll be sharing your golden locks with us. I'm looking forward to it. So we've come over time, but just any more thoughts or questions or reflections on the excellent work that Darren's doing? Okay, wonderful. Darren, thanks for joining us. If you want to stick around for this final session, you're welcome to keep contributing.